Autism regression is both heartbreaking and confusing. Whether you have a young child who's just starting to show signs of autism, used to say some words, now lost them, used to wave and now doesn't, or even an older child with a diagnosis of autism that regresses in some areas, it is very scary and, like I said, heartbreaking and confusing. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, online course creator, and best-selling author of The Verbal Behavior Approach. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today, I'm sharing a small excerpt from a podcast I did about autism regression. Autism regression, regressing of any skills when you are young or older is heartbreaking. A lot of times it could be a medical issue that's causing the regression. It could be an abrupt regression, like overnight your child starts seizing, or overnight he starts not talking. And the later it is, the more vocal. Like, I've heard stories, apparently, according to the research, 20 to 30% of parents report that their child did regress into autism, that they were developing on track or mostly on track, and then either had a sudden or slow regression. And I noticed regression, mostly in hindsight, with Lucas shortly after his first birthday. And I was pregnant with Spencer, so I wasn't really noticing, but he regressed. He stopped saying hi. He stopped waving. He used to really have a nice wave. And you think like, oh, he's just becoming a picky eater, or he has a cold, or he has an ear infection, and he's just a little off. And it was spiraling, and he was actually regressing. And the little cute baby songs and fill-ins that he used to do were gone. But I was pregnant, then I had the baby, then it was winter time. Older kids can regress too. But in that situation, it is very alarming when suddenly a 10-year-old regresses, even a 10-year-old with severe autism, if they suddenly lose skills that they once had, or again, more slowly. How do you turn things around? How do you help the child get unstuck? Step number one for any kind of autism regression or lack of progress is an assessment. And that doesn't have to be waiting in line for a doctor to assess, or having a behavior analyst assess. It can be a one-page assessment like I created that you can get at no cost at marybarbera.com/join. You can get a guide with that one-page assessment, and you can get started. So my thought is you really need to step back and look at the whole picture. So when you assess, we need to know, the age of the child and what their medical status is. Do they have a diagnosis? Do they have other medical complications and that sort of thing? And speaking of regression, it's really, really important that, especially if it's a sudden or even a slow regression, that you rule out medical problems, high lead levels, brain tumors, any kind of metabolic issues can hearing loss, that can all mimic signs of autism. There are autoimmune problems. There are bacterial infections like PANS or PANDAS, which I've done video blogs about, that can all cause a regression or cause symptoms of autism. You do want to go to a pediatrician or a family doctor. You might even need to go to a specialist who specializes in autism treatment, and really look closely to see what's going on. So whether it's a regression or just a lack of progress in the areas of anything, whether we're talking about a child who is not talking and you don't know how to get them talking, if they are 10 years old and not taking a shower themselves, or if they are having reading problems, or if they are having sudden or chronic problem behaviors that you can't control, you need to assess where they're at and where they should be at. So if it's a young child, I did a video blog on the MChat. These are tools you can check yourself to see, is my child falling really far behind? I did a toddler guide. Is it autism, ADHD, or typical toddler tantrums? You can get that at marybarbera.com/toddler. So just assess. And when you assess, don't count language and skills the child had more than a month ago, especially if you're seeing a regression, because it's not really helping the situation if you say, yeah, my child touches body parts, but he can only touch his body parts if you sing a song, or you haven't heard the word ball for 3 months, but you're still counting that as a word. And I get it. I totally did that. I totally counted all kinds of utterances that I heard from Lucas before he regressed. But so step number 1 is an assessment, medical assessment, language assessment, self-care assessment, problem behavior assessment. You want to know where your child or client is at and where they should be at. I use the VB map as a base. I also use the self-care checklist, which I find really helpful, by Dr. Mark Sundberg. And I also really, whether you have a young child or an old child who's stuck, we also need to look back and look at safety, look at independence and self-care, and look at happiness too. I think the field of ABA gets really caught up in diving in and trying to teach kids, but we really need to step back and make sure they're safe, make sure they're happy, make sure they're comfortable, and stop really keep pushing. If there's a problem and if they're stuck, then just keep pushing with the same programs, the same targets, the same procedures is not going to get them unstuck. And this is why I'm really excited that you're listening to this podcast and open to a new approach. And I have a new approach that is getting kids unstuck every day, which I am incredibly excited about. So for Lucas, my son, who's 23 years old now, despite 2 decades of the best ABA therapy I could find, he remains non-conversational. And, that doesn't mean I don't continue to teach him language. We teach him new language for new job title, like job work. When he goes to work, he has different jobs. So we teach him the names of the jobs and the materials that are part of the jobs. He needs to be able to request the parts of the jobs. I'm also teaching him names of new people that are in his environment, people at work mostly. And then teaching him, I'm just started to teach him to answer why questions, like why is the pool closed, or why is so-and-so not here today, or why didn't you go to church with daddy? And just trying to teach him because and the answer. And it's working. We're having some success. But just to remind you that, not all kids are going to be conversational. And it's not because of lack of trying. And, I'm not here to tell you that there's no chance. There's always hope. There's always a chance. And working on conversational skills with Lucas, answering why questions. He can answer a variety of questions, but answering why questions, teaching him yes and no responses that are reliable. Those kinds of things will really improve his quality of life. For Lucas, I believe he has reached his full potential, but that's not a once and done thing. That's continuing to have him reach his fullest potential, be as happy, be as safe, be as independent as possible. He his major problem behaviors at or near zero. And a lot of that actually was due to medical intervention. I did a podcast, with Dr. Murray, Lucas's psychiatrist. That's episode number 28. So you can find that at marybarbera.com/28. After you do an assessment, then step number 2, no matter where you're stuck, is you want to make sure that if you're stuck, your plan, your goals, your targets, your programs aren't correct. It's never the child's fault. It's always the people who are very, very much trying your best, trying to help the child. You need to, I use the analogy like peel the onion back. You need to find the layer where your child is going to be successful. So step number 2 after assessment is to revise the plan, the goals, the targets, the programs. If there's no progress in a program for weeks or months or years, you've got the wrong programs, goals, and targets. The child is missing prerequisite skills. I remember my first consultant who came in. We had a LOVA style ABA program in the beginning, and I talk about that in episode number 1, how we switched to a verbal behavior approach. It's all throughout my podcast, but I remember her saying, you want to get into a program and get out of a program. If you get stuck for weeks or months or years with no progress or limited progress, it's not the right program. And you might have to put the program on hold and go and fine tune what the prerequisites are that are missing. I hope you enjoyed this short snippet from the podcast. If you want more content, check out the podcast at marybarbera.com/podcast. Wherever you're watching this, I'd love it if you would leave me a comment, give me a thumbs up, share this video with others who may benefit. And for more information, you can attend a free online workshop at marybarbera.com/workshop. And I'll see you right here next week.